takbo, takbo, lukso, luksong tinik. Lukso, luksong tinik. Lukso!
Happy World Children's Day, everyone. I'm Gary Valenciano, UNICEF Philippines National Goodwill Ambassador. And today, as you can see, I'm in my studio again. And I'm just simply inspired to share with you a very special song that I'd like to dedicate to all the children out there, as well as all the children at heart among us. Now, as we all are experiencing this challenging time, we at UNICEF would like to give all of you a virtual hug and a message to keep hoping, to keep dreaming, and to keep working toward your goals. Let's all reimagine a world, a better world, where every child can grow up safe, healthy, and happy. So, the song was written many years ago, and it ended up becoming a part of the Awit at Laro album. That actually has remained to be my most endearing project ever. It was meant to encourage the young people to go out and play, because many of them now play with just their two thumbs on a screen. Nothing wrong with that. But to go out and enjoy the world using every part of your body to play, that's an experience. The thing is, I shared this vision with other friends of mine in the industry, like Lea Salonga, Bamboo, Ogie Alcacid, Joey Ayala, just to name a few. In fact, it got all the way to becoming a book, a songbook with all the lyrics and very special art pieces done by different Filipino artists expressing their interpretation of the songs that are a part of the album. You know what? It even got as far as going to the different malls, Ayala malls. There's like 22 malls all in all. I was in 17 of them, and I had fun. It's amazing when people come together and do it for children. And so this song, which is called Bawat Isa sa Atin, was written specifically for them. And you will hear the rights of every child in this song. This is not just from me, but from all of us at UNICEF, for everyone who has supported us and everyone who is now latching onto the vision of what UNICEF is all about for the children of the Philippines.
Maari bang pakinggan ang nais sabihin ng aking kanta? Hindi ito muli tungkol sa pagmumulat ng ating mga mata, kundi mata ng ating puso nang mapansin ang kaluluwa at mabigyan panahon ang daing ng mga bata. Bawat isa sa atin minsan ay tulad nila, naghahanap ng pagmamahal at pag-aruga. Kung ituloy ang laban, karapatan ng bawat batang nilalang, balang araw ating masasaksihan, buhay ng bawat bata, matupad ang pangarap nila. May mga batang walang landas, wala ng magulang, iniwang dukha, kahit kasalanan pa ng iba. Sa kanilang pagdurusa, ngunit ang aking panalangin na maudyok ang puso na gawin ng ating maintindihan. Hawak natin ang pag-asa. Bawat isa sa ating minsan ay tulad nila, na nais ay may magmamahal, may mag-aruga. Kung ituloy ang laban, karapatan ng bawat batang nilalang, balang araw ating masasaksihan, buhay ng bawat bata, matupad ang pangarap nila.
Maging bahagi ng pamilya, magkaroon ng hirahan, makapaglaro ng malaya. May pagtanggol sa abuso, dulot ng kulot na alitan, napagsilbihan ang namumuno, ahasa ang aking kakayahan, nais niya tutukan.
Bawat isa sa atin minsan ay tulad nila, na nais ay may magmamahal at mag-aruga. Kung ituloy ang laban, karapatan ng bawat batang nilalang, balang araw ating masasaksihan, buhay ng bawat bata, matupad ang pangarap nila.
Pangalan, maging bahagi ng pamilya, nais maging mapayapa, nais pakinggan ng aking daig.
Bawat isa sa atin.
Good morning, everyone. Such a good music to start this pleasant morning. I am Riza Lorenzana, Chair of Ako Para sa Bata 2020. The 12th Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme this year is Care of the Child Against Violence in the Time of Disease. We have a total of 23 webinars, and today is the 23rd and final webinar. The Ako Para sa Bata 2020 webinars are free of charge, a service to the Women and Children Protection Unit members and the entire Ako Para sa Bata community. Thank you for logging in extra early today. Please know that we appreciate each and every one of you. We are grateful for your loyalty and continuous support. We also have a virtual photo booth. We know how much you love taking photos, so even if you are online, you can still have your souvenir photo. You may scan the QR code flashed on screen, or you may access the link through the Ako Para sa Bata Facebook page. We have plenty of options for the photo frame, so please check them out. There you go. Again, just scan this QR code, pick up a frame, choose if you want to take a photo, a boomerang, or a GIF, then click and share. You have the option to make it accessible in our online gallery or not. You may also email a copy of your photo to your email address or post them on Facebook or Twitter. We look forward to seeing your photos. Feel free to tag us in your photos. We thank the 16,000 of you who are following the Ako Para sa Bata Facebook page. For those who are not yet following us, please do follow the Ako Para sa Bata social media accounts flashed on screen. Tag or mention Ako Para sa Bata and make sure to include the hashtag COVID-APSB 2020 in your posts. Again, it's hashtag COVID-APSB 2020. Let us start with the presentations. A very important research about young girls and women will be discussed by Plan International Philippines. We have with us Maricor Pauline de Guzman, Campaigns and Advocacy Specialist, and Mona Stella Mariano, Country Gender Specialist of Plan International Philippines. Study through her lens of COVID-19 on Filipino girls and young women. Let us all welcome Plan International Philippines.
Thank you so much, Dr. Riza. Hello everyone, good morning. Hello sa mga kabataan at bata na nanonood sa atin today. I'm happy to see you all online. First of all, happy World Children's Month. This is a very opportune time to talk about the concern and challenges of children and to continue working and collaborating together to ensure that their needs are provided during this difficult time. We thank the organizers of Ako Para sa Bata, the Child Protection Network, and UNICEF for inviting Plan International Philippines to share the result of our research through her lens, the impact of COVID-19 on Filipino girls and young women. So I'm Pauline, the Campaigns and Advocacy Specialist of Plan International, and also the lead researcher and writer of Through Her Lens. I'll be presenting the research findings. With me is Ms. Mona Mariano, the Country Gender Specialist of Plan International. She will share to us the conclusion and recommendations from girls and from our organization. So let me walk you through the result of the survey. So just to give you a brief overview, Through Her Lens is designed to analyze the impact of COVID-19 on Filipino girls and young women aged 13 to 24 years old. So majority of our respondents are actually adolescent, aged 15 to 18 years old. So the survey was conducted between April 20 and May 15, 2020. It was during this time wherein a majority of the Metro Manila and most of the local government units are under enhanced community quarantine. So the survey tool was actually designed by girls and young women themselves. Plan International, through our Girls Get Equal Advocates, we co-developed the tools and actually pre-test the tools as well in their cohort. So we disseminated the tool. We disseminated the tool via Facebook page and also through email. To also ensure that girls and young women who doesn't have internet connection, we also conducted a phone interview. So as mentioned, we disseminated the tool mainly through our Facebook account, but we also share the research via email through our local partners in the different areas in the Philippines. So we receive a huge volume of responses from girls and young women. So we seek the assistance of De La Salle University in managing and in analyzing the data. Okay, so we receive a huge volume of responses. So we seek the help of De La Salle University in analyzing and managing the data. So our team came up with a total of 1,203 respondents from 17 regions in the Philippines. Majority of the respondents came from Region 4A and NCR. Next slide, please. So to walk you through the COVID-19 impact on Filipino girls and young women, we will present here 4 key areas of the research. We will not be able to present all due to limited time, but we will present the impact on health and well-being, the impact on safety and protection, risk communication and information, and also the participation of girls and young women during this COVID situation. If you want to know more about the impact of COVID-19 on education, on economic opportunities, and also the coping mechanisms of girls and young women, please feel free to download our research via Plan International website. I think I can also share it later after our presentation via the list. So the impact on health and well-being. So we asked the situation of girls and young women, kamusta sila, and kamusta ang kanilang mga families. 57% of them said that their families are doing well, while only 40% of them said that they are personally doing well. Some of them said that together with their families, they are unwell. And the research also found out that there is a correlation coefficient between the personal well-being of the respondents and also the situation of their family. So if the family is not doing well, it's highly likely that the personal well-being of children are also affected. So we also ask them the emotions that they are feeling during the quarantine situation. So 52% of them said that they are feeling sad, while 40% said that they are frequently changing emotions. Significant number of them also shared that they are feeling bored and also angry and anxious during the situation. So we asked them what are the top common worries, and here are the answers. So most girls and young women are worried about the health of their family, the duration of community quarantine. So I think that most of us are also caught off guard as to how long this quarantine will be. So how much more for our children. 49% said that they are concerned or worried about school. So it could be because of the early disruption of classes, the delayed in graduation. It's also their concern, and also the resumption of their classes. 49% said that they are worried that they cannot leave their houses, and only 40% said that they are worried about getting infected by the virus. Significant number of them also said that, actually it's about 40% as well, they are also worried about the income of their families, of their parents, and also that there's no food during the quarantine situation. In relation to the impact of COVID-19 on safety and protection of girls and young women, we saw a number that is very alarming. So 56% of them said that they witness or experience violence against women and girls online. 17% said that they witness Bauji cases outside home, and 5% inside their home. So one of our respondents said that girls and young women and children must be educated about domestic abuse and sexual harassment so that they can protect themselves during this quarantine situation. So we also looked into what are the types of Bauji cases that girls and young women are observing. So for both houses, for both inside and outside their home or houses, they observe the same. So top is verbal violence. Next is emotional violence, followed by physical violence, and then sexual harassment. Some of them also said that they are observing or experiencing online sexual exploitation, which leads us to the next slide, which is top violence against women that were observed by girls and young women. So here are the top online violences that they are experiencing. So first is cyberbullying, proliferation of trolls and fake news. There is sharing and or posting of indecent photos, videos, or messages. So there is also online sexual harassment and receiving threatening and violent messages. So we ask the girls and young women what happened to the violence against women that they observe. While majority of them said that they reported it to the proper authorities, majority also said that they either do not know what happened to the situation, or they did not report it to the proper authorities. There are answers saying that the authorities responded to the situation, but some authorities also did not respond in the situation. So in relation to risk communication and information, because one of the key objective of the Through Her Lens is to know if our girls and young women and our children are receiving the right information that could help protect themselves during the situation. So 99% of them said that they are receiving information, and the type of information that they are receiving are news about current situation of the country, what to do during the COVID-19 situation, and the assistance that the government is providing. They are also receiving information about COVID-19, where to seek medical assistance, and who to ask help in case they need it. So they are receiving this information via primarily TV, and radio, but also using the social media. So in addition to the current information that they are receiving, we also ask if if they need more information that they still haven't received during the COVID-19 situation. And they said that these are the top three information that they need to be able to protect themselves from COVID-19. First is where to access hygiene and sexual and reproductive health items and services. Some of the girls are saying that menstrual or period doesn't stop during pandemic, and it's very important that they know where to get hygiene and sexual and reproductive items and services. Next is how to protect themselves from violence. So as mentioned earlier, malaki yung number talaga ng girls and young women who are observing violences online and also inside their homes. And it's important sa kanila na malaman how they can protect themselves from the situation. So finally, for the research findings, is the participation and contribution of girls and young women. So we ask girls and young women how they are contributing to the decision making. Most of them said that staying at home and following quarantine guidelines are their contribution. Some of them also said that advocacy through social media, and also helping in relief packaging and distribution of relief goods. In the risk communication part of the research, girls and young women also said that checking or fact checking and sharing of right information via social media is also part of their contribution during COVID-19. So one of the girls said that, Andrea, we quoted her, said that she personally thinks that it would be better if they can communicate and cooperate with their local government units during this COVID-19 situation. And this actually echoes a majority of girls and young women. They want to help during this situation, but due to lack of platform and also lack of information on how they can help, they weren't able to do so. So to share with us the conclusion and recommendation, I'm giving the floor to Miss Mona.
Thank you, Pauline. Magandang umaga sa lahat. Again, I am Mona, the Country Gender Specialist of Plan International Philippines. And from the findings presented by Pauline, I will now transition to our Through Her Lens research conclusions and recommendations. We already know that, as mentioned by Pauline, during times of disasters and crisis, girls and young women are often invisible. They are either clustered under the general category of children or women. And because of this, yung needs nila are mostly unmet and their voices unheard. So overall, as you've heard my colleague mention earlier, the findings have shown that inequities such as restrictions on mobility, lack of access to protection programs, and yung sexual and reproductive health services, they have placed them at a more disadvantageous situation during this pandemic. Furthermore, it also validated na yung capacities nila are being undervalued. Even if they've expressed that they wanted to help more, they are mostly consigned to performing household chores. And they said that they would want to be more productive and contribute more to responding better to the pandemic. So from these conclusions, we are going to present several recommendations from the girls, one of which is being shown now, and young women themselves. And then I will follow this with the recommendations coming from Plan International Philippines. So the first recommendation is the respondents would want to have the availability of information on gender-based and domestic and online violence. Because since the start of the pandemics, the girls and young women have been hearing about increasing cases of domestic and online violence, as was shared earlier. And they have been quite upfront about not being clear on how to report at saka ano ba yung mga reporting structures na meron tayo. And those who have reported incidences in their barangays, they have mentioned that they are not aware whether these have been acted upon. And one of them have said that they would like to have the reassurance, especially now, that they can run to someone they trust in case this happens to them or to their family and friends. So on sexual and reproductive health, many of the young girls, especially those below 21, because of the restrictions in mobility, they had they have been having limited capacity to access hygiene needs, no, such as sanitary pads, as was mentioned earlier. There are several who also mentioned restricted access to contraception, and they have been very frank as well in asking for support in getting these supplies. They requested that whenever there would be support coming from the LGUs or from NGOs, that the kits should always include items that would address these needs. And going now to mental and emotional support, as you have seen in the findings earlier, the respondents have been experiencing distress and shifts in emotions, which they do not fully understand yet and do not really know how to navigate. So a respondent, which we are featuring here, mentioned that the government should look at not just their physical coping, but their psychological management too. Girls and young women are asking for support in this area, especially since we have noted that there are increasing responsibilities at home, and they're also trying to navigate as well the new platform of education that are being that they would need to the modules that they would need to complete now. So aside from support on their mental health, they're also asking for interventions for their parents and guardians so that they will know how to better support girls and young women while studying and staying mostly at home. And this is actually what we want to emphasize as Plan International Philippines. We saw that we saw the need that there should be platforms for them to speak up and to be heard. Girls and young women are very much aware of their conditions and needs, and offer creative solutions to the challenges they face if they are given the space to contribute. So offering the platform is not enough. We have to be aware of that. And this means that the actors in the community should also be ready to listen and bring them into the conversation, and as well as in the decision making and planning processes. Knowing what the girls and young women need, how they are affected, how they can contribute are very important first steps, no, in ensuring that they are protected and safe during these times of crisis. So we are now moving to Plan International Philippines recommendations for the findings on gender inequalities and gender-based violence. We call on the government and civil society stakeholders to make sure that information on protection mechanisms are child-friendly and accessible. These are available most of the time, but they do not, since they cannot go out of the house, they do not know how to access these information, and most of them are actually not very understandable for their age groups. Intervention should also include raising the awareness of children and young people on when, where, and how they can safely access help when they need it. This would also cover gender equality programming for both at the household and community levels, which should address the observed increasing care roles and harmful gender norms. Related to what I have been discussing earlier on gender-based violence, in which we also have found significant findings on is on online violence. Since most of the social functions and engagements have been or are still moving online, we would want to ensure that this space is safe for children and young people, most especially for our girls and young women. We also did a research alongside our Through Her Lens during this pandemic, which showed that more than half of the girls ages 15 to 24 have experienced various form of online harassment. And we know that this is a more difficult space to navigate because of the extra anonymity, no, and data privacy that the internet provides. So we call on the government, civil society, and private companies because we know that this would involve a multi-stakeholder approach to be able to really make a dent in coming up with solutions on this. Uh, to increase awareness on online protection and online protective behaviors, we also encourage actors in this space to make sure that they consult children and young people because they do have a lot to say. They do have a lot of solutions so to be able to reach them better and to make the interventions more viable, no, to address the issues that they encounter. So on health and well-being, this is the last recommendation that Plan International Philippines is covering. We back up the call of our girls and young women to provide more information and supplies to address their sexual and reproductive health needs. We ask the government to be more proactive in addressing the arising mental health and well-being issues of our children and youth because this is not usually prioritized at the moment. And we know that though the government is the primary duty bearer and they have their hands quite full now, support can be provided by civil society and the private sector actors as well in the communities to respond to these needs. So to close, we saw that COVID-19 has made existing inequalities worse, just as with other health and humanitarian crises before it. And we at Plan International Philippines would like to emphasize that girls and young women have very particular needs and but still can play a very valuable role during times like this. We need to ensure that there are spaces for them to participate in the issues that concern them, in developing the solutions. And these spaces should actually not just be one-off engagements. No, they should be entrenched into the processes and systems that we already have to make sure that our responses are made more inclusive. Should you want to learn more about the research, I think Pauline had sent a link here in the chat box. But if you have any clarifications, please send us a message through our email addresses, mona.mariano@planinternational.org or to Pauline. If we can show that slide with our email addresses, that would be great. Okay, thank you everyone and a good day to all.
Thank you so much, Miss Mona and Miss Pauline. Indeed, your research highlighted the needs of our Filipino girls and young women at this time. So Plan International Philippines presented many recommendations, which I hope other organizations watching today should consider and include these in their respective programs. So I would like to emphasize one of the recommendations given by the girls and young women. That is to provide a platform where they can speak up, provide solutions and decisions. And this is exactly what we are going to do in the next hour. The next activity is a dialogue between a United Nations representative and the Filipino youth representatives. I will turn you over to the host of this segment. She is the Child Protection Officer of UNICEF Philippines. Let us all welcome Miss Faye Balanon. Over to you, Miss Faye.
Hello, good morning, everybody. Hi, good morning. It's going to be an exciting hour ahead of us right now. I would like to introduce first the kids who will be joining us today. And we have child leaders representing the three island clusters of the Philippines, Luzon, Visayas, and Mindanao. These adolescents are currently competing with other young groups from all over the Philippines in the Council for the Welfare of Children's Social Innovation Hackathon on HIV for children and adolescents, the Young Heroes Initiative's High Five. It's quite a mouthful, but uh, it's exciting. And as a community of youth leaders and mobilizers, these children are currently being trained to develop and implement community-based interventions to respond to their local sexual reproductive health concerns. Our child leaders joining us today are the manifestation that the children can influence and be part of the local solution. They are from at the team from Mindanao, Team SK Poblacion Nabunturan from Davao City. From the Visayas, we have Katinig, the team from the province of Capiz, and from Luzon, from the province of Oriental Mindoro, we have Team Positive. So those will be the children who will be joining us this morning. And to introduce our special guest, we have Patricia Benvenuti, who is UNICEF's Child Protection Chief, and she has almost 20 years of professional experience in international cooperation, child protection, social policy, and NGO development. Before the Philippines, she worked in China, United Kingdom, Somalia, Bolivia, Haiti, Dominican Republic, Nepal, South Africa, and Turkey. So to introduce our special guest, over to Patricia.
Thank you so much, Faye. Good morning. Magandang umaga, everyone. So it is a great honor and a pleasure to welcome and introduce Dr. Najat, the United Nations Special Representative of the Secretary General on Violence Against the Children. The Special Representative, as many of you already know, is a global independent advocate in favor of the prevention and elimination of all forms of violence against children. Dr. Najat has been doing so much to combat violence against the children, and this short introduction does not give justice to her incredible achievements and incredible contribution to this agenda. She's a pediatrician who has, over the last 3 decades, devoted her life to the promotion and protection of children's rights. She was the head of the pediatric department and director of the Hai Hassani Mother-Child Hospital in Casablanca, Morocco, her country of origin. She has also worked as a lecturer in Moroccan and international universities on child rights and is a member to several regional and international non-governmental organizations and networks working for children's rights. From 2008 to 2014, she served as the United Nations Special Rapporteur on the sale of children, child prostitution, and child pornography. Dr. Najat holds a doctorate in general medicine from the University of Rabat, a specialization in pediatrics and neonatology from the University of Bordeaux, France, and the Masters of Human Rights from the Human Rights Institute of Geneva. She is also the recipient of numerous awards and honors for her strong commitment to protecting the right of the child. Dr. Najat, welcome virtually to the Philippines. Over to you. Thank you.
Thank you. And really what I want to let you know is that I am really happy to discuss with the children who are for me the only expert, because really they know what happens, they have the solution, they have the capacity of assessment. And I need to be very humble. Since I start many years working with these children, I learned a lot. And I am admiring their courage, their survival intelligence, and also their creativity, their resilience. And really, I am so happy today to discuss with them and to learn from them.
Thank you, Dr. Najat. So we have our kids right now. Say hello, everybody.
Hello.
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 So,
Hello.
Dr. Nagad.
Yeah,
Hello,
sir.
doctor.
Hello po. Good morning.
Good morning.
How
Good
are you?
morning.
Mabuhay. Mabuhay.
Magandang umaga.
Yeah, Dr. Najat, would you like to ask a question, the first question to start things off?
Yes. Uh, I will. I have a question for you. I know that this pandemic, this huge pandemic, has impacted.
So, parang ang tanong niya, ano ang impact ng pandemic sa mga bata ngayon? At kahit mag-Tagalog, kahit mag-English, ipakilala niyo muna ang sarili niyo kay Dr. Najat bago kayo sumagot. Gusto niyang marinig ang inyong boses at pagtingin.
So, good morning, ma'am. Yes, I am John Christian Batiles. I am a member of Team Katinig from Capiz. So, for me, it has affected the children greatly because we're still coping up with this new normal. We're sometimes tired and stressed because this is very new to us. COVID really changed most of the things that we are used to, but we don't have a choice but to adjust and cope up with this new normal. Sometimes children are being depressed because they think that COVID is going to end it all. And that is a wrong mindset. We should always think positive despite of all the problems that we are facing today. Thank you.
Thank you, John. Meron pang gustong magdagdag?
Bina from Team SK Poblacion Nabunturan
Mm-mm.
and from the heart of the valley, Nabunturan, Davao de Oro.
Yes, go ahead.
So I think these are the issues that the Filipino youth, are facing today, na maaring may kinalaman sa pandemya o maari ring wala. Una, sa panahon ngayon, maraming mga magulang ang nawawalan ng trabaho kaya't napipilitan silang pagkasyahin ang kakarampot na kita para lang mapakain ang mga anak. May mga ayuda ngang binabahagi, ngunit hindi naman lahat ay nakakatanggap at ito'y nagiging sanhi ng pagkagutom ng mga kabataang Pilipino. Dahil rin sa pagkagutom ay napipilitan silang mag-involve sa mga malisyosong gawain katulad na lamang ng cybersex upang may panggastos at makaraos sa pang-araw-araw.
Sige, translate ko muna ha. Dr. Najat, he said that sometimes it has something to do directly with COVID and sometimes it doesn't. The issues that families and children face in the Philippines is that there are no jobs really for everybody, and it results to little resources to buy food. During COVID, they did receive some help from the government, ayuda, but not all received it. And it also resulted to hunger. And hunger, in turn, resulted to children and families becoming desperate and being involved in cybersex and exploitation.
Yes. So, pangalawa, the Filipino youth are mentally and physically drained. They are experiencing stress, anxiety, and depression, and may sometimes lead to suicide attempts. And another thing is, second, the Filipino youth are mentally stressed and they are mentally and physically drained. They are experiencing stress, anxiety, and depression that may sometimes lead to suicide. Another thing is this is between children in the city and children in the province. The Filipino youth living in the city are mentally exhausted and are at a higher risk of getting COVID-19 since there is an increase of such cases in the cities. However, the Filipino youth in the province are struggling to cope up with the online class system because of the slow internet connection. Not only that, but access to health services are limited, making them more vulnerable with getting infected with the virus. That's all. Thank you.
Thank you, Josh. Yes, Dr. Najat, I think they have shared their answers to your initial question. Would you like
Thank
to reply?
Yes, I want to reply, if you allow me. And I think what they highlight really, it's the same. They are the same findings that we saw with many, many children worldwide. And I think this pandemic has increased, the inequalities that were already existing. This pandemic has also, e- impacted the services that were already weak before the pandemic. And one main point that they highlight is really the main point regarding mental health, because it is really impacted. And we know that mental health is really not very well dealt in many, many responses. And feeling stressed, tired, anxious. Also, in some countries, we saw that we have an increase of suicide attempt, of depression. And they highlight also the fact that we have difference between, the environment where children are living. In cities or in rural areas, they are facing challenges, but maybe not the same, because in the city, due to the increase of contamination, they have a big fear. And in remote areas, they have the big problem of access to services. And the main problem they highlight that it's really important to take into account is also all the added stress on families because of the huge impact on the socio-economic, status. And here it's really important to start thinking about the link between social protection and also child protection services. And also they highlight also that child protection services have to be seen as a life-saving services during this pandemic, as well as mental health, education, and social protection. And that another point that they highlight is also the disparities regarding access to education through internet, because in many places when you are living in poor families or in remote areas, you have no access really to internet and to the remote learning. And it means that you have really a huge number of children who have no access really to education because they have no access to internet. And we know that third of children who could be students worldwide have no access to remote learning. And they highlight another point is regarding also child protection online, and also the fact that due to the poverty and also to this bad living condition, you have all the big risk of more and more sexual exploitation, child labor, and we know also worldwide that we will have also an increased risk of also child marriage worldwide. And I think these really are the main important things that they highlight. If I may, I have another question. But the big issue regarding reaching children who are at need of protection is the most important thing is how we can reach the most vulnerable, you know, to make sure that those who are normally in a normal life already invisible, forgotten, really, if they have a kind of really counsel for me or guidance, how we can better reach the most vulnerable children.
Naintindihan niyo? Gusto niyong i-translate pa? Okay lang? Okay lang, mga bata?
Okay naman
Okay lang.
po.
Sige. So ang pangalawang tanong ay paano natin maabot yung mga mahirap abutin na bata? Sinong gustong sumagot?
Good morning po.
Ako na lang.
We have Cheverly and Vincent who will answer. Cheverly will go first. She turned on her mic first, and then Vincent.
Yes po. We were able to reach those who were geographically isolated children by applying the things that we are doing in such as distance learning. We can provide them modules to make sure that they can cope up and to be able to have their mental health okay, we are also going to do some psychosocial activities, which were also included on the modules. And as for that, since we, the youth, just like us, are those who were aware that they don't have enough access, so we can do our part. We can go to their communities and we can ask them. We can offer them help so that they can cope up with the new normal.
I, Cheverly, you forgot to introduce yourself. Introduce
Yes
yourself.
po, I'm so sorry. Okay po, so good morning. I am Cheverly May Shopno from Team Positive Oriental Mindoro po.
Are you uh, a part of the youth movement there? Are you part of a student government, of a youth council? Can you tell us more?
Yes po, I'm an SSG student din po. I'm also a Girl Scout and I'm also doing some advocacies related to it po.
What is SSG?
Supreme Student Government po in our school.
Thank you, Cheverly. So, Vincent, where are you, Vincent?
Okay.
Hi,
Do you
introduce
hear me
yourself
po?
first, Vincent, and tell Dr. Najat something about yourself.
So I'm quite nervous, honestly. But first of all, Dr. Najad, good morning. And I am Vincent Federico, also from Team Positive from Oriental Mindoro. So to further answer your question, para madagdag kay Ate Chev, first thing first, pwede po kayo na lang po mag-translate. Yan,
Sure, I
okay po.
can translate.
So, ang isa din po sa nakikita ko is, kailangan alam natin kung sino sila. Siyempre, makikipag-coordinate tayo sa barangay para malaman kung sino yung mga tao, especially yung mga youth, kung sino talaga yung mga geographically isolated at siyempre kung sino talaga yung mga bata na nangangailangan talaga ng tulong natin. So, yun, kailangan natin malaman kung sino sila.
Yeah. First thing that we have to do as young people is identify who the children that needs help. We have to coordinate with the barangays to look into geographically inaccessible areas and really ask them or identify who needs help. It's important to know who the children are. Go,
Yeah.
Vincent.
So the next one is, of course, we should establish youth organizations because these youth organizations are those who are specifically concerned on those youth that need help. And moreover, pwede din po nating i-integrate or mas palakasin pa yung mga established na mga youth organizations. Para kung ganoon kasi, yung mga established youth organizations, sila yung mas nakakaalam kung ano yung gagawin para sa mga youth natin. And moreover, we should have that connection, that big stable connection. We should have that big stable connection on the geographically isolated youth and also to the youth organization. And of course, who are already aware of the situation.
It's important to work with established youth organizations in those areas and not just strengthen them, and because they are the ones who understand and know the situation among the children they work with and in their area. It's important that there is a very strong connection to these youth organizations, to anyone who wants to help.
Yes.
Right. Anything else, Vincent?
But above all, magagawa po natin ang lahat ng to. Masusolusyonan natin lahat ng bagay kung siyempre nagtutulungan tayo at may isa tayong direkto na pupuntahan. Yeah, that's all po.
We can find solutions and work on solutions only if we are together and we are agreed on that we are moving towards one direction.
Yeah.
Yeah, okay.
That's all.
Yeah. Thank you, Vincent.
Thank
Dr.
you.
Najat.
Really many thanks, and you have not to be stressed, because really you are doing a wonderful and great job, and I think you can provide lessons to policymakers, because your approach regarding reaching the most vulnerable is first to know them better, to identify them, to know their needs, and to use all the networking that already exists and building on the existing networking services to reach and to strengthen. And you highlight one strong point is also the sustainability of this connection. It's not only one shot, and to have it in a kind of really ongoing way. And also regarding what Cheverly was highlighting also, I think, is really all this peer-to-peer initiative that we are really providing mental health support, documenting your experience, sharing your experience, and also providing, counseling, guidance, and solution. And also when it's not possible is also to visit and through visiting communities. And in other countries, what we saw, they also use TV, radio, and caravan to reach those who are not connected. I really want to really congratulate you, because you have the good approach to reach the most vulnerable and also to make them part also of the solution, empowering them. If I may, I have another question. I have time. Let me know if I am. We heard a lot regarding many youth initiatives. And, as I was telling you in the beginning, for me, it's not possible to prevent and to respond to all matters that are concerning children, including violence against children. And with this pandemic, it's not possible to respond and to recover without putting children at the heart of the decision. What does it mean? Is really listening to them, informing them, empowering them, providing them pathway, and really to make sure protective when they can speak up, when they can express, but also they can provide solution. And what I saw, and you were part, many children were part of the COVID initiative, hashtag COVID under 19. And we have many NGOs, and Plan, who is here today, is also part of it. And you were more than almost 200 children who were part of it from Philippines. And what we saw, and it's really highlighting what you were telling, almost 50%, half of children really were not aware about where they could have a kind of access, where they have to go when they need help. And what we saw also, that two main priorities for them were safety and education. And another point, what we saw also, is also all these wonderful initiatives, this peer-to-peer helping, providing support, helping also communities, raising awareness, and pushing really to make sure that their views are really listened. And in my work as special representative, for me, it's an important piece. And I am finalizing with my colleague from my office a mapping of all children initiative worldwide. And this, for me, it's very important to channel your voices, your concern, your proposal, your solution to really the decision makers, to make sure that we are going to influence them. And my question is, for you, how you see my mandate and all adults today who are here, how we can make sure that child participation, ethical, inclusive, meaningful, empowering participation is really systematized in all the policy responses during the pandemic, but also before, but also during the recovery. And just let me know how you see us making sure that we are going to influence policymakers.
Thank you, Dr. Najat. Mga bata, naintindihan yung tanong? Kailangan ng tulong? paano makakatulong ang mga bata na makaimpluwensya sa mga gumagawa ng batas natin? Ano kayang pwede niyong gawin bilang bata? Sinong gustong sumagot? Kahit sino.
Hello po.
po.
Morning.
Si Cheverly?
Yes po.
Yes.
Good morning po, Dr. Najat. I'm Cheverly po from Team Positive Oriental Mindoro. We can influence, as children, we can influence those who were capable enough and those who are in position to bear with us by doing first our actions. We can communicate with them. We can be a part of a group which prioritizes such things, and we can also ask help when we needed help, and we can also have some assistance from youth groups, so such as that po.
Thank you, Cheverly. Mayroon pang gustong magsalita? Paano makakatulong ang kabataan? Paano maipapaabot ng kabataan ang nasa sa isip nila? Hi, Sandra. Pakilala mo muna sarili mo.
So, good morning everyone, especially to Dr. Najat. Good morning. So, I am Zandaline P. Calage from Team SK Poblacion Nabunturan, Davao de Oro. So, I am a part of an organization called SK, which...
Oops. I think we lost Sandra. Is there anybody else from SK Poblacion who wants to? Hi, Mike.
Hello.
Oh, Sandra is here. Is Sandra back? And then after Sandra, Mike. Yeah. Sandra, are you back?
Sorry for
Ayan.
the interruption.
Okay lang.
So,
Yung
as I was
naputol ka
saying,
nung
so I am a part
SK.
of...
Yeah.
Yes, yes po. So I am a part of SK or Santaan. So this organization is not only in Mindanao, but it is found in the entire Philippines. So this organization is a community-based. So ito ay isang organization kung saan ang mga namamahala or the ones who are leading are children or youths in the community. So this organization is nakaangkla po ito sa sa barangay kung saan kung ano ang mga programang maaring mapag-usapan sa SK ay maaring madaling isangguni sa barangay dahil kasali po ang aming SK chairman sa mga gumagawa ng batas para sa aming lugar.
Thank you, Sandra. Sandra is part of the Sangguniang Kabataan or the Youth Council, which is linked to the Barangay Council, the Community Council. They are voted by the people in the community. It's the smallest political unit in the Philippines. And there is a specific youth council that is voted for by other children and other youth. I added that part about being voted by, just to provide a whole context. Sandra said that the SK is led by youth in the community, and they are the SK chairperson is part of the barangay council, the community council, where the SK works with the barangay and influences local policy. Sandra, did I get that correctly? Tama ba?
Yes po, Ate Faye.
She said yes, the translation is correct. I double checked. Mike.
So, good morning, everyone. Good morning, Dr. Najat. I am Mike Albert Castillo Amores from Team Katinig, Sagyan Capiz, Philippines. In our barangay, student leaders nor the Supreme Student Government are engaged in sessions and allowed to talk and express our needs to share our ideas and thoughts. We are grateful that our officials are also supportive on our plans and projects like Bulyo Ganay and Pamaskong Handog. They are also supportive in helping us distribute modules in our barangay. That's all.
Thank you, Mike.
Hi
Anybody
po.
else? Yes.
Hi, I'm Noala Jillian Garcia Basco from Team Positive of Oriental Mindoro. So, for me, community is really important. Communication is really important. We must build relationship trust in order for them to trust our opinions and perspective towards the problem. Have a plan on how to communicate your suggestions to the officials so that they would listen and support. For us to be heard, we must speak. And for us to speak, we need a lot of knowledge. So we'll have the confidence to use our voice as the instrument to change something we want to change. So yun po.
Thank you, Noella. Anybody else wants to share? I think that's it.
I have a question for you. Maybe it will be difficult. As I heard, many of you are part of council at community level in the barangay, if I understood well, and others are part of networks, and they are listened by the policymakers at local level, and they are heard, and they heard also about communication, building trust. My question is, what I saw in many countries, I didn't visit Philippines yet, but maybe I will do it soon, and I will meet you. But what I saw that you have children who are part of many councils and many even children parliaments, many clubs and so on. And some policy makers are maybe listening, but not really hearing. And what my question is, when you express your proposal, when you express your views, when it's duly explained, and policymakers are not really taking them into account, my question is how we can make sure that how you can do it or do in another way to make sure to convince policymakers really that this is a good solution, because what I saw worldwide is really very, even for us adults, it's very, very difficult to make society, adults, and in many countries, and policymakers seeing children as key partners, as key agents of solution of positive change. And I just want to hear you how we can, because this is my big challenge. I want policymakers worldwide recognizing that children really have to be part of the solution. They are not only beneficiary of services, and I am fighting against all this one-shot participation. If you could help me, it would be wonderful.
Naintindihan? Gusto niyo i-translate? Sabi niya, ang tanong ni Dr. Najat banggit ninyo na may member kayo ng mga SK, nakaka-impluwensya kayo dun sa inyong mga barangay, pero may rekomendasyon kayo kaya paano kaya sa mas malaking arena, sa mas malaking lugar, sa mas malaking sa bansa natin, sa mga gumagawa ng batas natin. Ano kayang mas magagawa ng mga batang tulad nyo, mga leader sa inyong mga komunidad, upang mas marinig ang boses ng bata na hindi lang parang one shot, na hindi lang parang isang meeting, pupunta mga bata, okay na. Ano kaya ang mas magandang paraan para mas marinig ang boses ng bata pang matagalan?
Okay, so ako na lang po muna uli mag-aano.
Oo. Tapos sorry, si Jazz pala kanina nakataas ang kamay. Jazz, kung gusto mong mag-share mamaya ha. Sige, Vincent?
Kasi po nagbasa din po ako sa comments dito sa ating webinar, and I like to share po this isa pong sinare participants, the youth today taking to be part of the solution is bravo. Totoo naman po yun. So, the youth today must be part of the solution kasi akala kasi natin na kapag bata, walang alam. Na yung connotative saying na yung knowledge comes from experience and age, yung gano'n ba? Kapag mas matanda ka, mas marami kang alam. Pero kung tayong mga youth ay mapungsige, matalino, at magaling tayo mag-isip ng mga paraan, we are innovative, we are engaged in researching, mas makakagawa tayo ng mga solusyon at tayo mismo kung sino yung mga youth na talagang may ganong kapasidad, sila yung may mas mataas na tsansa para makapag-communicate sa mga sa mga government agencies natin.
Vincent said that he was reading some of the comments, and he said what he read in one comment is that youth must be part of the solution. And he agrees with that completely, because the usual thing is that adults usually see children like they don't know anything, because knowledge and wisdom comes with age. But however, children are motivated, they are innovative, they do research, and if they do this, they will be able to communicate their thoughts and recommendations to lawmakers. Correct, Vincent? Thank you.
Yes.
Meron pa?
Yes po. Hello po.
Hi, Jazz. Is that you?
So, hello po, Dr. Najat. Good morning po. So, I will do some first introduction po muna kasi we prepared po yesterday our introduction. So, all the way from Luzon, from the province of Mangyan, Halcon, and Tamarao, we are the Jolly Kids of Oriental Mindoro. We are team positive, and we believe that basta batang positibo, panalo. So, yes. So, Dr. Najat, as for your question po, why should the youth be involved in making the solution for the some issues and problems in the youth in some countries is I think the youth should be involved because we are the one who experiences the problem and we are the one who knows the issue more. We knew it better and we are experiencing it now. So the connotative of some adults that youth are just being exaggerated or overreactive about it as per to some depression or stress, and I think the youth should be involved in making some solutions and answers to those problems because we are the one who experiences it, and we should stop the concept that the older ones are always right because people change, right? And as for our generation now, we are so much innovative and we are so much advanced compared to the youth from the past decades, right? So I think we, the youth, should be involved in such solutions. Thank you.
Thank you, Jazz. A couple more have raised their hands. Sandra?
So, good morning again.
Sandra?
Hello?
Yes.
Well, good morning again. So, as what I have said earlier, so we are part of SK. So, as youth organization in the community, we have passed resolutions to the barangay in which kung ano yung mga gusto naming suggestion or mga programa na iparating sa mga kabataan ay ipinapasa ng aming SK chairperson through resolutions, through agreements sa barangay council kung saan dinidiscuss nila ito kung dapat bang ipatupad sa aming komunidad at kung
I will translate before we lost her. Sandra, I will translate muna ha.
okay.
Yeah. Sandra said that again, she is part of the SK, and what they do is pass resolutions. They pass resolutions about programs that they want to be implemented in their communities that is focused on helping children and youth. And these programs are discussed with the community, and then she got cut off. Are you there, Sandra?
Yes, Spotify.
Oo, ituloy mo na.
Hello.
Yung
Tapos,
dinidiscuss sa
yun,
community, tapos?
oo. Tapos pagkatapos po, kapag na-agree ng buong council, ng barangay council,
Oh, we lost her again. Sandra, we lost you again. Yes?
notify.
Oo.
Eventually na ma-approve, tapos yun ma-implement yung mga programs po.
Mm. Sige. And it is discussed by the council and then approved and will be implemented in the community. And then we also have another raised hand from Cheverly.
Yes po, good morning po. I'm Cheverly po again from Team Positive, from Oriental Mindoro. To wrap everything up, we must, for the youths like us to be heard, we can prove them that we can do more, not just by using our cell phones, being on social media every time. We can prove them that we can be more and we can do more. First, for us to be heard, we must able to build partnerships with some groups, just like having organizations, and just like we have the National Youth Commission, we can send or we can partner with them for our insights, for our suggestions to be heard. So that's it po.
Thank you, Sandra. Anybody else has their hands raised? I can't see everybody, but just speak up if you want to add something. Hi, Jodeline.
Hello, good morning. Good morning, Dr. Nagat. So for us to be heard, first po, we need to partner up with some organizations. And then we need to hear the voice of the youth and their problems or us to state po sa mga policy makers the need and the problem so that matutulungan po natin yung mga co-youth natin na nasa may mental health issues po right now. So, para may pakita po natin na kaya ng bata and para po sa mga bata. Thank you.
Sorry. She said that it's important to partner with youth organizations. The youth, it's important that the youth partner with organizations so that they will be able to help other young people and children on mental health issues and that they can show what they can do. Anybody else gusto magdagdag?
Hello po, good morning.
Good morning.
I wish to add to that question. Hello, good morning everyone, Dr. Najat. I am Kim. I am part of the Team SK Poblacion Bunturan, Davao de Oro, a youth volunteer of the Municipality of the Living Treasure of Davao de Oro. For the question, I think we need to change our aspect and put into mind that the youth is capable of being able to make responsible decisions pertaining to the issues we have today. Apart from being able to establish a connection or being able to partner up with the public sector, the government sectors and government organizations that we have in our nation. I think it is also important. It is a key factor in encouraging our lawmakers themselves to be child advocates, because it is important that because the youth is, we need to keep in mind that the youth is still, that the youth holds the future of our nation, and being able to hear what they have to say, what we have to say about the important issues and matters that we are currently facing today, it holds a very it holds a crucial part in shaping the future of our country, the Philippines. So that is all. Thank you.
Thank you. Anybody else who wants to, last call for anybody else who wants to share? Okay, I think that's it, Dr. Najat.
Thank you so much. Regarding, I also read in the chat, I heard a lot about, using social media, connecting, partnering, with other organization, trying to have a kind of advocacy, raising awareness to change also the mindset of the adults and the policy makers. And also what I heard is also the fact that you can do more. This is important, and we need to really provide you support to do more. This is important without instrumentalizing you. I think for me this is a main important thing regarding also our way of work. And I heard also another point, that it's really you are passionate, and you believe on what you are doing. And I think, children are not only the future for me, they are the future of the nation, but they are the present. And really, to be very frank with you, I am convinced about that. But you know better than me that you have more and more, adults and policymakers that are not convinced. And just regarding social media, to remind you, you have many children who are not belonging to any organization, that are expressing themselves, that you have more and more blogs, more and more networking, more and more things appearing. You have more and more social movements that start within social media and really embed on streets. And you have also what we are seeing, that you have also many children, because they are protesting in a pacific way, they are arrested. They are really victims of many forms of violence. And I think here really it's important currently what we are seeing. I am truly convinced that you are part of the solution. And you have not only part, you have pragmatic solution, because you have experience, you are innovative, and in the same time you have this creativity. And I think also what I saw in one chat is also the fact that you have this resolution really to make sure, to advocate, to make sure that it's adopted, but also you have a role in the implementation and the monitoring. This is very important to make all these actors accountable. And I saw also another chat in one that you have this possibility of using petition, collecting many voices, that really having a big volume, really to occupy the space and that yes, we are. And we have that. It's not only about complaining, but it's also about acting. And really, I want to congratulate you very strongly about your commitment, your passion, and really continue doing it. This is wonderful because I trust you. And if I may also, I could answer to question, provided by all this wonderful human rights defender.
Yes. Do you have questions for Dr. Najat? May tanong kayo sa kanya. Kayo naman na magtanong. Dr. Najat has been asking all the questions. Do you have a question for her? Yes. Hope?
Good morning, Doc. I am Hope from Team SK Poblacion of Nabunturan, Davao de Oro. So, this is my question, Doc. Ate Faye,
Oh,
paki-translate
sure.
na lang po.
Game.
Ano pong advice na inyong maibibigay sa mga organisasyon, especially po katulad namin mga kabataan, na tumutulong sa kapwa naming kabataan na mag-address ng awareness o mag-address o mag-implement ng mga programa o project tungkol sa child against violence? Yun lang po.
Do you have any advice to child organizations, child and youth organizations who are working towards raising awareness and implement programs for children?
Yes, not advice, just to share with them lessons learned, because I think they could provide me more advice than I can provide them. I think, what I saw and worldwide and since many years, that youth and young children and young people, because I need also to make sure that we are also including children, because this is very important. And they have a lot of things to tell, because if I understand well, it's also about preventing and ending violence against children, if I understand well the question. And what I saw, that you have many group of children who were really involved in preventing and in building networks within schools, within community, to fight some forms of violence regarding, for example, bullying and cyberbullying, providing counseling, working with the teachers, working with the counselor, working with the family, working with the community to raise awareness, to change the mindset, and also to work on peer-to-peer violence. This is one example. I have another example, and I just before, when I was in Bangkok, when I met Faye and all the team from Philippines in Bangkok, I was visiting Indonesia just after, and I met wonderful organization of children and young people who were working, very hardly with the community, with religious leaders, with policy makers at local level, at national level, regarding, preventing and ending child marriage, female genital mutilation, and other really wonderful also program I saw, and very strong involvement when children and young people also were working on empowering and strengthening all the child protection online, explaining to the other really how we can be empowered, how we can recognize. And during this pandemic, what I saw, and the number of child-led initiative and young-led initiative to provide peer-to-peer support, to provide, mental health, to document their experiences, really to build these bridges, even they are confined, were wonderful. And it is why I'm working, as I was telling you, compiling and mapping all that to really show to all policymakers, not only at global level, but also at regional and national level, that you are really wonderful in responding, in implementing, in preventing, when we provide you with the correct information, when we provide you with a protective pathway, when we trust you, this is very important, and we provide you the opportunity really to implement, to monitor, to discuss, to have this constructive dialogue. And this is one of the main challenges I think we face currently within all these policymakers. But I think what I heard from you today and what I saw today, I think you are doing a great and wonderful job. And I hope, and I really congratulate the organizer and ACO para Sabata. This is wonderful. It's you, if I understand, it's me for other children, because I try to understand the translation. And I think what is important is how you can document and really raise and mobilize. And what I suggest you, we are in a globalized and connected world. Really build bridges with the other, share your experiences, and really become more and more strong. I think you have a great opportunity to have a kind of strong movement, that it's positive, showing that it is possible to do it with you, for you. Over to you, Faye.
Thank you, Dr. Najat. So, mahalaga talaga ang connection. Mahalaga ang connection sa isa't isa, sa peers natin, sa mga organisasyon, sa mga gobyerno, at wag din natin daw kalimutan ang mga bata. So, pag sinabi nating bata, children and youth. So, ano pa? Meron pang gustong magtanong? Last question?
Hello, Dr. Chat po. It's me again, Jess po. I think my question is kind of related to the earlier one, but I'm still going to give it a shot. So, Dr. Najat, since you're from the UN and you pretty much have a knowledge on what's happening in other countries, right? So, can you please still share us some situations that kind of similar to our country, some situations that or issues that problems in other countries, and how did they take action? How did the government take action or projects have they done to cope such issues po? Thank you po.
Mute.
I will try to summarize because I am seeing worldwide what the pandemic did, and not only within the low-income countries, even the developed countries. It has increased violence against children, domestic violence. Children were victims of domestic violence at home, but also experiencing domestic violence against their mom. And here we see the close connection between violence against women and violence against children, as was highlighted by Plan in the beginning. Another big forms of violence is, violence online. And we saw, due to the widespread digitalization and the increased connection worldwide, an increase of child sexual abuse material, an increase of child sexual predators that are connected. And we saw also an increase of bullying and cyberbullying, and also hate speech. And in some countries, we start seeing a kind of enrollment of children within violent extremist group, just to let you know. But what we saw also, that the most vulnerable children worldwide, even in the rich countries, because they are poor, because even in the rich countries you have poor children, because they are deprived of family care, because they are on streets, because they are disabled, because they are detained, because they are living in camps, refugee camps, because they are displaced, because they are living also in armed conflict countries, and they are becoming more and more and more vulnerable. And we know that many children, due to their situation, have no access to many services. And what is coming, and this is a big problem, it's a huge socio-economic impact worldwide. And we, according to World Bank, by the end of 2021, we will have an addition 150 million people who will fall under the extreme poverty, and mainly women and children. And this means for children, the risk of increased child labor, the risk of increased child trafficking, the risk of increasing child sexual exploitation, the risk of increasing child marriage, the risk of increasing discrimination. And why it's important currently that we need now, because we are facing the pandemic, second, third wave until the vaccine came, and we don't know when. And we are building, working on building back better. And here we need you also, because you are working with all your policymakers to make sure that child protection, child education, child health, including mental health, and social protection, including universal health coverage, including sustainable support for all the families, fighting gender inequalities and social disparities, have to be really, really included in the socio-economic recovery package. This is one of the main important things. And the last and final point, that children has to be involved in designing, in implementing, in monitoring, and seen as part of the solution. Over to you, Faye.
Thank you, Dr. Najat. Wow, you see what is important in our future recovery. Ang kailangan talaga ay ang boses nyo sa pagplaplano ng isang package para makarecover tayo sa pandemyang ito. Isang package na kasama kayo sa pag-design, sa pagplaplano, sa implementasyon at sa monitoring. Dapat may boses ang bata at dapat kasali kayo. Marami siyang binanggit din, di ba, na tungkol sa dapat magkakadugtong lahat. Hindi lang isang bagay, kundi kasama rin pag pinag-usapan ang protection sa online sexual violence, dapat pinag-uusapan din ang pang-ekonomiyang usapan, dapat pinag-uusapan din ang kalusugan ng mga bata, dapat pinag-uusapan din ang kanilang edukasyon. So, pag tayo ay nagplano, magandang balikan natin yung sinabi ni Dr. Najat na pag tayo nagplano ng tulong natin sa mga ibang bata, pagtutulungan nyo ang mga peers ninyo, dapat alalahanin natin ang mga magkakaugnay na iba't ibang bagay. Mayroon pa kayong gustong sabihin? Do you still have anything you want to say? We are running out of time, but it's been exciting. Unless anybody else wants to say one last word.
Can I po ba?
Yes po.
Okay, so to summarize all this dialogue, it's been a fun and constructive dialogue to Dr. Najat. Thank you po, and also to Ate Faye. But above all, on what I saw on the chat on the Zoom, the one that caught me is that we should be God-fearing. Youth, or even all people must be God-fearing, and we should be all role models to our society so that we can inspire more to do better. And also, from our team name, syempre, we should be all positive in mind. So we should be able to have positive in mind, and so that we can have a positive action towards the betterment of our society. And also, pwede itagalog ko na lang, sa mga nanonood po, yan, sa mga kasala sa webinar na ito, ang isa sa pinakamagandang solusyon natin ngayon is, even after this webinar, pwede natin gawin is, kamustahin natin ang mga youth. Simpleng pagkamusta, oy, kamusta ka na? Sa messenger, pwede natin gawin yon after this webinar. Oy, kamusta ka na? Oy, baka may problema ka, pwede mo i-share sa amin. Because that simple conversation would help them uplift, and also, simpler solutions could be simpler solutions yan. Madadagdag hanggang sa masod na lahat. And that's all. It's been a fun morning yun. That's all. Thank you po.
Thanks, Vincent. Dr. Najat, he added in Filipino to the participants, he had a message to the participants of the webinar, and he said that after this webinar, maybe it would be good that you ask young people in your life, or young people in general, or young people you know, how are you today? Drop them a line on Messenger, and because asking them how they are seems simple, but it's important, and it will have impact to them. And sometimes little simple solutions can add up to something big. That's Vincent's message to the webinar participants.
I have nothing to add because I think he did it well. And just I want to let you know that, yes, when we are child rights defender, it's not only about, wording, it's also about behavior and attitude. And it's really important. And you can meet a poor child or a poor person with disabled and so on. It's your equal. I think really it's important. And here it's also about this culture, these values of listening, of hearing, of sharing, and also of being humble. This is very important. This is what I learned. I just want to tell one word, to tell you I really enjoy. It's 10 p.m. here in New York, but it's not the morning. But I really enjoy having this time with you. And just I want to let you know that you can reach me really, even without this, all the webinar, if you need to discuss, to have a more deep dialogue, I am really here to build bridges and to see how we can really do more and to use my mandate as a tool for you, a backup, not taking your place, really to see how we can really provide you the support needed, the visibility needed, and also playing this convening role, building bridges between you and other, networking of children. I just want to tell you, thank you so much. I really, really enjoy this time spending with you, and I hope that I will have another time, physically time to spend with you. Thank you, and thanks the organizer.
Thank you, Dr. Najat. It's been a wonderful hour and an exciting hour for the kids and the webinar participants. Before ending, I would like to thank the Philippine Youth Development Network who helped us reach these children who are not in the usual city centers. They are in the provinces that are usually off the beaten track from the usual national capital regions and the usual big cities. Thank you, PYDN. And I'd like to thank the participants too. As you saw, the children are reading your comments and your suggestions and recommendations. They read them all, and I'm sure that they will be learning from them too. And of course, thank you to Ako Para sa Bata organizers. I am for children. Uh, and for the 12th Ako Para sa Bata, and the first one that is ever conducted online over the span of 3 months.
Excuse me, can I add
Yes.
something just a little bit?
Opo.
Sort of an ending statement, kung baga.
Sige.
So,
Go.
it has been an incredible journey and an honor to be able to join this discussion with everyone, with Dr. Najat and everyone, including the viewers, and being able to be as one of the representatives of the youth. Although the current situation has had a few setbacks, the new normal has had a few setbacks. I really think it is something to be proud of, that we are still doing or showing our best and showing our resiliency and innovative ways in keeping up with the new conditions, because I do believe that our service as part of the youth is of the youth, by the youth, and always and will always be forever for the youth. Okay. Thank you.
Thank you, Kim. And yes, andito kami, ang mga participants, lahat na nakikinig, ewan ko kung umabot na tayo ng 1,000, lahat ng mga taong to na nakikinig sa inyo ngayon ay nasa likod nyo at sumusuporta na marinig ang boses ng kabataang Pilipino. Maraming salamat sa inyong lahat. Salamat! Maraming salamat, Dr. Najat. Maraming salamat.
Thank you po.
Thank you.
Maraming salamat po.
Thank you so much,
Thank you
Doc.
po.
Mabuhay.
Thank you so
Mabuhay
much.
po.
Mabuhay. Mabuhay, long live.
Mabuhay ang kabataan.
Fighting.
Mabuhay ang
Fighting.
kabataan. Over to Dr. Risa. Rizzy.
Yes. Thank you so much for such an insightful interaction this morning. Thank you, Dr. Najat, for hearing the Filipino voices, for hearing the Filipino youth voices. And again, thank you so much to Team Positive, Team Katinig, and Team SK Poblasyon na Bunturan. You really make us proud. E mabuhay ang kabataang Pilipino. Let us now proceed to our closing ceremonies. So after 23 webinar, after several webinars, and this is our 23rd, I cannot believe we are already closing. So let us now listen to the message of UNICEF Philippines representative, Oyun Saikan, then Devnorov.
Magandang araw to all social workers, doctors, lawyers, psychologists, law enforcers, government officials, and young people with us today. Thank you for remaining committed to uphold and protect children's rights despite the odds. Congratulations to Child Protection Network on the success of the 12th Acapara Sabata Conference with a very relevant theme of caring for children against violence in the time of COVID-19. The pandemic truly brought new challenges to all stakeholders in ensuring that children's right to survival, development, protection, and participation are fulfilled. It has affected the socioeconomic situation of children and families, learning and access to education, and the mental health of both children and adults. Moreover, the violence against children is rising at home, communities, and online. But there are lesser and lesser reports of abuse, and lesser children are seeking help from professionals. This is why this year's Acopara Sabata conference is important, as it brought together professionals, experts in the field of child protection to find new innovative ways to address issues on child abuse, neglect, and exploitation specific to the context of a pandemic. UNICEF is really proud to support this gathering of passionate professionals and advocates where voices of children and adolescents are heard and valued. In all our endeavors, the children's voices, experiences, and recommendations should be loud and strong, and adults should be considering them seriously. We will continue working hand in hand with all of you to improve services and capacities of our health and child protection frontliners, as well as our teachers and parents in surmounting the challenges of blended learning and parenting. UNICEF will always be one with Filipino children and all stakeholders towards a reimagined future where every child is healthy, educated, safe, and protected. Maraming salamat po.
Thank you, Ms. Oyun. And to give a summary of what has happened in the last 3 months, let us all welcome the Scientific Committee Chair of Ako Para sa Bata, Dr. Sandra Hernandez.
Thank you, Rizzy. The Ako Para sa Bata 2020 webinars were guided by 4 objectives. The first objective was to describe the impact of COVID-19 on violence against children, explain the consequences of COVID-19 on case management, discuss best practices and innovative solutions, and provide support for parents, caregiver, adolescent, and child well-being. Unprecedented circumstances called for unprecedented measures, and so our 2-day conference gave birth to 23 webinars in 3 months. We started the first month with defining how COVID-19 affected our daily lives and how we could move forward and dance with the virus. We heard reports, emerging data on increasing violence during the pandemic, and highlighted the growing threat of online sexual abuse and exploitation. The second webinar enlightened us on local government measures and community responses in addressing gender-based violence against children. This morning was a fitting end to the webinar series as we heard about the concerns of young girls and heard directly from youth across the country their thoughts and ideas about moving forward with COVID-19. It was very fascinating and amazing to hear the exchange between New York, Dr. Najat, and the youth from Oriental Mindoro, Capiz, and Davao. Going back to the second month of the webinars, this set of webinars analyzed how COVID-19 affected women and children protection work. Doctors described the renovations that had to take place in the women and child protection units and changes in protocol to become COVID ready. On the other hand, social workers, mental health specialists, Judges, lawyers, and law enforcement described the problems they encountered because of COVID-19 and the ways that they coped with these challenges. We also put a spotlight on new, well, not very new, but special frontliners because doctors and teachers have unique access to children who are locked down at this time. We also heard about the special safety and ethical issues that VOW and VAC researchers faced during COVID-19. In between these discussions, we thought of you, our frontliners. These webinars were designed to help us take a pause and reflect on our own personal challenges and ways by which we can care for ourselves even as we cared for others. We also thought of helping you navigate and access medical services via telemedicine and also how to help you protect yourselves as consumers online. The last set of webinars on the third month focused on supporting parents, caregivers, adolescents, and children during the pandemic. Central to our work as women and children protection frontliners is the mental health and well-being of children and adolescents. For this, we had our adolescent medicine specialists and mental health specialists discuss to us, help us understand mental health and well-being during the pandemic. Equally important is supporting parents. And these webinars provided very practical and inspiring tips on how to parent during a pandemic and help us understand our struggles as parents and our newfound roles in our children's education. With the schools closed, children now spend half or more than half of their time online, and we made sure to inform everyone about safe and healthy internet use. These last fun-filled webinars, of course, were created for children, but they were also designed for parents to remind them about more creative ways by which children can pass their time these days. All of this would not have been possible without the unwavering trust and generous support of our co-presenter, UNICEF Philippines. Thank you, UNICEF Philippines. We would also like to thank each and every speaker who took time out from their very busy schedules to share their expertise with us. We thank the youth reactors whose voices enriched our discussions. We thank the moderators who helped make the webinars as interactive as possible. And we thank the chairs who wholeheartedly and patiently organized their sessions, some for the first time and some for the nth time. We hope to continue in the coming years as we grow and continue with this network that we have. Maraming salamat po.
Thank you, Doc Sandra. To discuss the way forward, may I call on the Executive Director of the Child Protection Network and Conference President of Ako Para sa Bata, Dr. Bernadette Madrid.
Thank you. Thank you, Rizzy. So we have reached the end of the 23 webinars, and I hope that everyone was able to learn something. And this way forward is based on all those 23 webinars. And I think what will happen is that after I say what is the way forward based on those 23 webinars, you are going to look back and watch those 23 webinar recordings again, because that you will be wanting to review all of the details. So I think what we have learned first is that the response to COVID is a whole government approach, but it is with collaboration and coordination of everyone. I think what COVID has done is really make it clear that every individual has a role if we are going to defeat it. It's not just the work of government. So what we've also learned is that child protection is an essential service. Everyone is now in agreement that there was a rise, or there is a rise in incidents of both violence against children and violence against women. Maybe initially we saw a drop, but now what we're seeing is the rising number as children now are seeking help, and that those who are already vulnerable even before COVID has become even more vulnerable now with COVID. So what we've seen is that what we did before was not enough anymore. So we needed to do so many innovations on the fly. So we have migrated, or we are migrating to online, and that it's not only now the children who needs protection, but everyone needs protection some way or other, and that we cannot remain in our offices. We need to collaborate more with community-based services, especially barangay workers. Internet access has become also an essential need, but it is double-edged because it also brings its own problems and safety issues. But we cannot do without the internet now, so it has to be affordable. And I think what we're going to see in the next few weeks is that this will happen. We could access internet using satellite. I think the executive order is being prepared so that the satellite, through satellite means, internet will be accessible even in the GIDA areas, the geographically isolated and disadvantaged areas. We hope that we will decrease this digital divide and not create another problem because of this need for the internet. So, but this we know, however, that this access to the internet will also mean that we need to have cyber safe programs to protect children and adolescents and even adults from what's happening in the cyber area. And as we've learned in the past webinar, OSEC in the Philippines has risen by 264%. And with this increased access, we will see more if we're not careful, if we're not prepared, and we don't know how to protect our children from OSEC. The internet also has brought a new way of learning. So most of our trainings now is also online, and not only trainings, even basic education is now online. So we all need to be able to see how we can do this better. So maybe, this is our way of really getting the change that we need, in terms of curriculum. So as we say, while on one hand there was a crisis, this is also now opportunity to see all those changes that we need to see happen faster. Okay. As has been emphasized in this last webinar, both by the children and by UNSRG, we need to reach those who need help. We have to find out who they are and where they are. Over now, child helplines are very important. And so we need more child helplines. But the golden rule here is that if you have a child helpline, the service must be answered. You cannot have a helpline wherein nobody answers. So we need to know how to do this well. Okay. We need to train community workers because they're right there. They're where the children are. They could help us identify and monitor. That's why at the start of this webinar today, we showed you the barangay training graduates. We're going to do more of that. And it's not only the barangay who needs to work on this, to help, to reach those who need help. We need neighbors to help neighbors, friends to help friends, and bystanders to help those in need. So we see there, the whole community working together to find these children who need help and to reach out to them. Families need support, we know that. We may need to, we not only may, we need to increase the scope of the 4 Ps program, especially in these next 3 years at least. The SAP is not enough. So we need an expanded 4 piece program. We know that the parenting programs are important because the home is the center. The child's world has really shrunk to the home while it has expanded to the cyber world, but their base is the home. So we cannot overemphasize the importance of parenting programs and supporting these parents because they have also become the teachers, because the home has also become the school. So um, more than that, children receive services in school that may not be there now, and so we those same services may need to be given in the home. For example, feeding programs. We know that unemployment has reached an all-time high, so livelihood programs based in the home will also need to increase. So people need to know how they can have livelihood programs that will be based in their home, be it online or real. This has been repeated again and again that access to mental health services is critical at this time. We see more children and adults with mental health problems. So telemedicine to reach these children and adults in the communities and in their homes need to develop fast. Psychosocial helplines for children and adults has to be done by both government, non-government, and all of the professional societies. Because schools are closed, school guidance counselors also need to offer online services. And this needs to be done fast also. But while we're doing things fast, we need to evaluate whether these are effective or not. It doesn't mean that because we do something that immediately it's effective. So we need to do research and we need to do evaluation. Even as we're doing it, we need to do this parallel to the new programs that are being instituted. And as we have seen today, children should be part of this policy making. Their voices need to be heard, and decision makers should consult children. And from what I've seen, I think that this should be part of Ako Para sa Bata every year. That children's voice, that the Ako Para sa Bata should be one way, a systematic way for children's voices to be heard now that we are building this community and that we have you, all of you, listening in and participating every time. Disasters will always be part of our lives. Even while we were coping with COVID, we had Rolly, you know, we and the latest typhoon, we have Yuli. So we have to be prepared. This is part of our life, and that preparing for disasters should be really part of the budget already, to be as specific as that. And the way that we do things, we should part of it is already be what we do when there is a disaster. So long-term solutions start today. Okay. So I'll end with these 2 slides. COVID made us realize what is important in our life. We have this opportunity to make things better. Merry Christmas! Tuloy pa rin ang Christmas. Thank you.
Thank you, Doc Bernie. And before we move on with our program, we just have one more poll question. For those on Zoom, please participate by clicking on the box that will appear on your screen. So those joining us on Facebook Live, you may answer by leaving a comment. I will read the question and options so everyone can participate. Okay, so what is your preferred theme for APSB 2021? What is your preferred theme for APSB 2021? The choices are Building Back Better for Children, Breaking the barriers of calamities for children. Breaking barriers, bridging gaps, building resilience. An acronym for APSB, Advent of Parenting Sustains and Builds Stronger Community. Positive discipline, developing survival or life skills and values of children. Or if you have other suggestions, you can type it in the chat box or the comment section in Facebook. So again, what is your preferred theme for APSB 2021? Next year. So please choose among the options: Building Back Better for Children, Breaking the Barriers of Calamities for Children, Breaking Barriers, Bridging Gaps, Building Resilience. Advent of Parenting Sustains and Builds Stronger Community. Positive Discipline, or Developing Survival or Life Skills and Values of Children, or others, or if you have other suggestions, I can see someone who typed Building Connections Internationally. Breaking barriers, reaching gaps, building resilience. So I'm reading the suggestions in the chat box. Maybe now share their answers. Everyone is greeting Merry Christmas. Okay, so it's a close fight between 35% breaking barriers, bridging gaps, building resilience, and about 32% chose developing survival or life skills and values of children. So thank you very much everyone for participating. So every year we end the conference with a pledge. May I call on Attorney Katrina Legarda, Director of the National Network of Women and Children Protection Units, to lead the pledge.
All right, we are at the end of our 2020 calamitous year and the end of Ako Para sa Bata online. So please follow me as we give our normal pledge. Ako, tayong lahat, para sa bata.
Para sa bata.
Thank you and Merry Christmas.
Tinig.